One of the most common complaints people come in with is low back pain. It can affect young kids, it can affect middle-aged people, it can affect older people. It's a common complaint. And one of the questions I get is, can you help me with my low back pain? And the hard answer on that is absolutely, I can help you with your low back pain. One of my favorite types of patients is people that have chronic conditions, because it's very gratifying to see someone that has had pain for most of their life, intermittent or chronic, and it responds very well with chiropractic. There's two common causes to low back pain, and a lot of times they're intertwined. One of the main causes to low back pain is joint dysfunction, and some people will label that as arthritis or degenerative joint disease, but that really doesn't mean a lot in my treatment process. If you have joints in your body, I can help you with your pain. One of the questions I will ask people is, when you wake up in the morning, is your low back fine, and as your day goes on, it kind of tightens up as the day goes on? That would indicate that it leans more on a muscular side of treatment, and I can help that with what we call trigger points. Most of the time, though, when people wake up in the morning, you wake up and you get out of bed and you have to do one of these things, because your back is really sore, but as you move, it gets better. That indicates that it is a chiropractic problem, definite chiropractic problem. A lot of times there's a meshing between the two, and with the treatment that I do, I deal with the joints through the chiropractic analysis and treatment using the activator. We talked about that in the first video, and I'll do another video on the activator. And also I do something called trigger point therapy, and that deals specifically with the muscular dysfunction that is contributing to the low back pain. They are very intertwined, and that's why it's so important when you get treated by a chiropractor. And this is what I do when you get treated by a chiropractor. If you just get the joints adjusted, you're leaving a little bit of space of dysfunction within the musculature. So to effectively treat low back pain, you have to have a collective approach using activator, which I do, and using trigger point therapy. And I'm very good at determining and treating both of those. So you come in, and we always balance out the joints first. And that's really, really important. You get on the table, and we did a video on that. Get on the table, and I'll show you with my test person right here. We'll get you on the table. Table will take you from a standing position to a lying position, and this is a really good process. This table specifically, rather than climbing on a table, is really good because it maintains what we call a weight-bearing posture. It's how your body is as it's standing, and it maintains it as the table goes down and preserves what we call the weight-bearing posture. So when the patient gets on the table and they've come in, say, for example, with a low back issue, what I will do, and I'll get you to bend both knees and back down. And then the shoes go on both feet. These are adjustment shoes. And through the analysis and the activator treatment, I can figure out and treat the areas of complaint with the low back issue. Now, if someone comes in, and this is really, really important to remember, with a low back issue, I have to look at the entire body, because the low back issue may be originating within a problem in the low back, or it may be caused by a pelvic dysfunction or a rotated knee or a fallen arch. So all of these things need to be addressed to effectively treat the low back. Patients come in and they'll say, I have low back, and I start treating them, and they're like, why are you adjusting my lower neck? It's not my neck, it's my low back. But again, from a holistic approach to effectively treat one part of the body, you have to look at the whole part of the body. So patient comes in, I will do what we call, first of all, I will do a leg length analysis, and that's determining if the legs are balanced, the bottom of the feet, the ankles, the knees, the pelvic, the hips, going all the way up the spine. I'll use the activator to reset whatever joints are in what we call dysfunction. And that could be, say, for example, a knee, the arch of the ankle, the pelvic on one side or the other. An activator is a very effective way on resetting the pelvic, which is the basic or the the foundation to the low back. And that's why when you come in, I always start at the bottom and I work my way up. And then we get to the low back and we go all the way up to the neck area. There's tracts in the spinal cord that can be affected if the neck is off balance that will throw the low back off. So that's why we always approach the low back by analyzing the entire body and treating the entire body appropriately. So you come in for a low back, I'm not just going to hone in on the low back, we're going to look at everything and then specifically look at the low back area. There are muscles that are always involved in low back pain. So if you have a pelvic dysfunction or a hip dysfunction, we're going to look at supporting musculature within these areas, the piriformis muscles, all of the glute muscles, the paraspinal muscles, and the quadratus muscles, specifically involving the low back. And how do I do that? I will assess based on what I find from a chiropractic point of view, relate it back to the muscular area, and determine if there is a trigger point in that area. And a trigger point, and I'll do a separate video on trigger points, is an area in a muscle that has tightened up over time to help stabilize the back. It's there to help you, but long term it can be detrimental and can cause different issues and can contribute to the low back pain. So once I've cleared out and balanced out the spine, I will look at the musculature. And the musculature will involve the quadratus muscles, all of the glute muscles, the piriformis muscles, and the muscles that go down through the leg. I will determine if there are trigger points and I will treat those trigger points. So not only are you getting a chiropractic adjustment, which is really the primary treatment that you want to get, but I will also balance out using trigger point therapy if that's something level of care that you choose to get. Once the treatment is done, I always check to find out if that treatment has made a difference. And that's why when you do come in to get adjusted, you're going to feel me going back and forth. I'm checking, I'll do a treatment, I'll come back and I'll check, and I will go back and forth at least 30 times from your feet to your spine, always reevaluating where we're at and seeing if there's a change from the treatment that I gave. An analogy that I like to use is like the foundation of a house. You don't just go into a foundation of a house and crank it back into place. You make general adjustments in different areas until you can get the foundation of the house balanced. And that's the same thing with the body. So low back pain is a very, very common complaint in a lot of people. It is one of my favorite things to work on because I can look at the entire body and figure out where the primary cause to the low back pain is. Sometimes it's the low back, sometimes it's the pelvic area, sometimes it's the hips, sometimes it's a rotation in the knee or a fallen arch. A lot of times there's a neck involvement with it as well. Even though you're not having low back pain, there's tracts, fasciculi that go down through the spinal cord that if the neck is twisted, it's going to pull on those, which is going to cause your low back musculature to be off balance. And so by getting adjusted and adding the musculature treatment, the trigger point treatment, it's a really effective way in treating the low back issue. So once the treatment is done, depending if you've decided to get the basic treatment or getting the advanced treatment, depending on how long you're on the table, I'll bring you up after rechecking to see if we made a difference. One of the things that I mentioned that I've not yet mentioned is I keep really good notes on all the treatment that's been done on each visit that you've come in. So I can document how far the body's been off and how you've responded to the treatment each time. So I'll get you to tuck your toes. I'm going to bring the patient back up after being treated. Depending on how long they've been down on the table, I will bring them up in stages. So we'll stop, if he's been down for 10 minutes, we'll stop once for about 15 seconds, and this allows the body to adjust being in an upright position. A lot of times if someone's had a low back issue and they've been down for a while and I've decompressed the low back, as the table comes up, the weight comes back on the low back and they'll start feeling a little bit of discomfort. And that's why we come up slowly and bring the patient up in stages. So to summarize, low back treatment, chiropractic and activator and trigger point therapy is a really effective way in treating low back issues. Is it 100% effective? Well, I hope that it can be 100% effective. Sometimes with the treatment, someone's pain level on a scale of 1 to 10, if 10 is really bad and 1 is no problem, it's a scale that we use right here. If 10 is really bad and 1 is no problem, if they've come in and their pain level has been at an 8 or 9 and we can get it down to a 2 or 3 just with a chiropractic and trigger point therapy, I feel like that's such a gain, and it gives you vitality back in your life, which really is invaluable.